just kind of trying to move some fluid through the tissue. Usually there's swelling after an injury or when an injury is healing. So we're just going to try to move a little bit of that through, just like this. Hey guys, Dr. Will here from Miami Spine and Performance in Hollywood, Florida. Today I have a patient here that I'm going to work on, and I'm going to walk you guys through what I'm working on and why I'm doing it. So this patient suffered a fracture of her kneecap earlier in the year, so she fell directly on her kneecap. But one of the big things that happens when you have a fracture or another injury, as many of you watching know, is that it starts to cause problems elsewhere, right? So even after maybe the fracture is healed or the injury in one area is healed, other areas start to get tight and sore as well. So at this point, her kneecap is healed, but she's come in for treatment for some of the other issues that she's experiencing, like tightness in her quads, weakness in the hamstrings, and some calf pain. So today we're going to focus on working on her calf. So I'm going to show you guys a little bit of active release technique here. So all we're going to do is we're going to put a little bit of pressure down, and we're just going to let her foot release. A little bit of pressure on the calf, and let it release. So what I'm trying to do here is I'm just trying to put a little tension through the muscle and gently move her knee through a comfortable range of motion while stretching out the calf a little bit. So this calf muscle here crosses the knee, meaning that if we're extending the knee, we're lengthening the calf as well. Now I'm going to work the other part of the calf, which is the soleus, which is a little bit deeper, just by bending the ankle here. Are you doing okay, Sherry? Mm-hmm. So I'm going to find those trigger points that are deep, and I'm just going to kind of stretch through there and release them. In her case, she's got a little bit of tightness through here, so we're going to just release. And a lot of times, this is what the muscles need after an injury. Even after an injury is healed, they just kind of need to be stretched out and moved around a little bit, right? This pressure on the muscle is helping signal the body to reduce pain, bring blood flow, bring oxygen to the area to kind of start that healing process over again. And then the stretching is helping her with mobility. So now when she walks out of here, instead of, if we're just rubbing the tissue, it might not stick as far as her movement. Since we're incorporating movement into the stretch, now when she walks out, she's going to be able to use this new range of motion. Okay. Now that the tissue is a little bit warmed up, we're going to use one of our tools here to release the calf a little bit more. So this is our Ached Away scraper. Shout out Ached Away. It's a great tool. We have a heated scraper here. So I'm going to put a little bit of lotion on the calf. And we're going to release away. So I'm going to do some strokes upward to start. And we're just kind of trying to move some fluid through the tissue. Usually there's swelling after an injury or when an injury is healing. So we're just going to try to move a little bit of that through, just like this. Maybe I'll scrape the other way as well. I also have the ability to feel where some of the knots are, because I can feel as the tool's going over the knots where those areas are kind of a little bit more bumpy or where the tissue's not quite healing properly. So I know you all love to watch the shockwave therapy, so typically I'll start with something like this. Shockwave is very powerful. So these type of therapies are good for just kind of opening up the tissue a little bit, creating some blood flow. And you have to be cautious after a serious injury. We don't want to go in and start, banging on the body too much. So we're just going to do some kind of gentle releasing here, opening up the tissue. And then I usually like to finish with just some kind of broad stroke massage work, just like this. And again, we're just trying to release some of these trigger points that are in the tissue, open up the muscle. It's all about bringing oxygen to the area, reducing inflammation, just kind of making her a little bit more comfortable with walking. Also do some strokes up the calf, just like this. She's been on her feet a lot. It's holiday season, so we're just kind of trying to give this calf a little break for a while and just let the tissue open up a little bit. Okay, guys, so there you have it. That's where typically I'm going to start with a patient like this. Again, we're just trying to put the body in healing mode at this point. Some other things that we would do, we would maybe add on shockwave therapy. Of course, we would start doing some physical therapy, rehabilitation exercise. I'm also going to put her in the Normatec boots as well to help with blood flow. But again, for those of you that, maybe you have a knee injury, an ankle injury, maybe you don't like getting adjusted, maybe you had a bad experience with a chiropractor. At this office, I treat just as many sports injuries and injuries like this as I do back and neck pain. So if you're looking for somebody who's, if you're looking for rehabilitation, soft tissue work, and a really systematic approach, Miami Spine and Performance, I got you. See you next time.